And now what we'd like to do is we are very honored to have three partners who are here with us representing community, clinical, and our Native-led, Native-serving community-based organizations and partners. So we have asked them to share a bit about their experience and their partnerships with HealthierHere. And we would like to invite, let me just check my screen here. We would like to invite Kyle Shorbeck. Kyle is with Unkitawa, and Unkitawa is one of our Native-led, Native-serving community practice partners, as well as a community grants recipient. So Unkitawa has been an incredibly valuable partner who has worked with us in various areas as our part of our work, not just as our community partners, but certainly in our governance and leadership here on the governing board and the Indigenous Nations Committee. Kyle.
Hi, everybody. It's good to see everybody on the call today. So, Maria, thank you. So, not real good at speeches, so I made a few cliff notes, if you will. Prepared a little Word document here. So, how matakiape, machiaplo shajeki oyate waioki amani, ikta ian sloan ikche wichasha. My name is Walks for the People or Dances for the Women from Standing Rock, and I'm a common man. So today I come with an open heart and an open mind, and I speak the following words from my heart and with truth. First of all, we would like to thank HealthierHere and the members inside of the organization that have been so supportive and even made the work through HealthierHere possible in the first place. I would like to especially start and thank and acknowledge in our way. What we do is we acknowledge those people. And I don't mean to leave anybody off this list, but I would like to especially thank and acknowledge as they have been instrumental in our efforts to date. I'd like to thank our sister Abriel, our sister Maria, Mayani, Twee, and Susan for all that they have done and helped us with here over at Unkitawa. We appreciate you, and we send good thoughts and prayers to each of you on this call, and we are thankful for today, for none of us know if we will have tomorrow. Good things happen to good people. The effects of the partnership with HealthierHere and Unkitawa as a small CBO has been profound and impactful in a very meaningful way. It has assisted us in helping the AIAN population in this time of COVID by way of expanding and enabling programming that we simply would not have been able to do otherwise. There's little doubt that this has helped to save lives in our community, and that touches my heart. I think it's literally saved lives. I know it has. It's helped reduce health disparities and lessen COVID in our community. Not in the traditional medical sense, but in our traditional medicine ways that we do. A very small, underserved community. This relationship has heightened our awareness of the institutional barriers that exist within the healthcare system, as well as provided light and help and hope that these barriers can and will be overcome. These barriers do exist, and we hope that in the coming year or thereafter that one or more of the healthcare providers will find a way to work within the system that we all live in to allow them to support the traditional medicine practices in the AIAN community in a way without all of the institutional paperwork and bureaucracy that are currently in place, which seem to be the biggest barrier. And that the healthcare and institutions are able to meet the AIAN community on our cultural and spiritual norms and in our spaces, for that is how it will change. And that they do it within the confines and within our norms and our spaces, which do not require tons of paperwork and bureaucracy. And it is built on mutual trust. Our way of doing these things is built on trust, not gobs of paperwork. There is light in this, in that we have had several initial conversations with several of the healthcare providers. And I thank and acknowledge them for our mutual efforts to date. I think these are good initial steps and openings that simply would never have occurred, I don't think, or maybe it would have been many more years into the future if it were not for the brokership and the common space that HealthierHere brings, various organizations. It's very hard for small organizations or small populations of people or unrecognized or people to gain a table and gain audience with big and powerful institutions. HealthierHere has brought into common space for Unkitawa and other CBOs partnerships and relationships that we would not have otherwise probably had and maybe not ever have met. HealthierHere has opened the door into these spaces that we did not have access to before, and we value and appreciate this very much. HealthierHere has dramatically helped Unkitawa and other CBOs greatly increase our capacity via the ability for us to have personnel, right? Because here in a lot of us in the Indigenous community, we all have other jobs, right? We don't have the luxury of having a paid position in the healthcare profession. We have to do this in our off hours. And so it's very impactful even when a few people can do this full time. It has helped with the telehealth, right? That's something that we have Zoom and cameras and microphones and computers and phone plans and things that allow us to reach into the community in a way that we were not able to before. So that has been very impactful, and we use it regularly. One of the biggest success stories that has happened in this last year, I think, has been the traditional medicines. I don't know how many people on this phone call can truly appreciate the impact that it has outside of the traditional institutional healthcare system, how hard it is for us to just be able to get the things that we need to have to distribute to the people that aren't aspirin and pills and normal medical things that you find in the hospital, but the kinds of things that we distribute, like the plants and the medicines that we have, right? That in the past has been, and to a certain degree even now, has come out of everybody's own pockets, right? Or they have to go pick and find them themselves. And that medicine distribution program that happened earlier this year has been very, very helpful. It's distributed to hundreds and hundreds and hundreds of people. That's something that would like to see continued in the future. And again, that has literally saved life. We've heard verbal testimony from 4 people in the last month, like that it's literally, they believe, saved their life and their health and their sanity. We look forward to this relationship, and we're excited for all the good things that will come of it. And we're supportive and wholeheartedly behind the joint efforts of everybody on this phone call to save the people, everybody in Washington State. Let's help everybody be healthy and in a good place in their mind and in their heart and in their body. And with that, I'm going to bring my 3 minutes of fame to an end. Hechitu alo, matakie oasin, Kyle Sherbeck and Unkitawa. Thank you.
Kyle, thank you so very much. Thank you for sharing on behalf of Unkitawa and many of the other Native-led, Native-serving organizations, because I know as you share, there's a lot of work that happens collectively and collaboratively, and it is all centered on serving people. And so just really please accept this thank you from us to everyone at Unkitawa and everyone who is actively working in this space and collaborating in this space for the people. Thank you, Kyle. Thank you, Unkitawa. It's an honor to be on this journey with you. Thank you. And next, we'd like to welcome Consejo Counseling Service and Mario Paredes. Consejo is also in a fabulous and unique role with HealthierHere as a community partner, a clinical partner, and a community grants alumni recipient. So we have really been honored to work very closely with Mario and the team at Consejo. Again, really centering on how we can help collectively improve the lives of the people that we are here to serve. Please join me in welcoming Mario Paredes.
Thank you, Maria, for this partnership. Thank you, board members and everybody present on this meeting. Today's presentation will be conducted by two of my peers, Greg Kleiner and Terry Bispo. Let me introduce them to you, and they will be leading our presentation, Terry Bispo and Greg.
Thank you, Mario. So hi, everyone. I'm Terry Bispo, and I'm Consejo's Clinical Director of Integrated Clinical Services. I want to thank everyone for having me present today about Consejo Services and the work we've been doing towards transformation, and also thank HealthierHere for our partnership. I'd like to begin just by reading Consejo's mission, which is to provide a continuum of behavioral health, substance use, and domestic violence services to individuals and families across Washington state to improve the quality of their lives and empower clients to participate in their communities at their highest level of functioning. Next slide, please. So just a little bit about Consejo. We are a 501c3 organization. We've existed since 1978, and our focus is on serving low-income and immigrant communities. We are licensed by the Behavioral Health Division of Behavioral Health and Recovery Services, and we have 11 locations across 3 counties, King, Pierce, and Mason counties. Our headquarters is located in Seattle in the Columbia City neighborhood. We have several departments: outpatient mental health and outpatient substance use, among other services to the youth, children, and families, domestic violence. We offer transitional housing, complementary medicine. We have a violence prevention program, sexual assault services, and partnerships with primary care. So with whole person care, Consejo has worked on whole person care for several years as we've partnered with Bushir University, for example, and other medical partners in the community. In the past year, we've really worked really hard on enhancing our biopsychosocial assessment, and we've provided trainings for our clinicians. And as we're enhancing our biopsychosocial assessment, with the focus of capturing individuals' behavioral health and also physical health needs. Some of the things that we've done is that we've included tools such as the PHQ-9, which is a depression screen, a Columbia Suicide Rating Scale, and the GAD-7, which is a general anxiety disorder scale. And most recently, we also have implemented a pain screen as part of our biopsychosocial. As we look at someone's physical and psychological needs, we also want to look at the history of opiates and substance use as a coping method related to pain. And so in that way, we can also see if a person needs further assessment, and we can collaborate by referring someone to a pain screen, for a pain assessment at a pain clinic or with their primary care physician. So we're reviewing some clients' physical health needs, nutrition information, and chronic conditions. With the help with HealthierHere and our partnership with HealthierHere, we've been able to staff a full-time medical assistant. She is fluent in Spanish, which is the majority of our clients in King County. And she's been a wonderful addition to our team, providing integrated care coordination between our physical health partners and our therapeutic staff. So some of the things that she does is charting the client's vital signs and updating medication lists and history, and collaborating with our internal and external providers. In our office in Seattle and our clinic in Seattle, we also have partnerships with Swedish Cherry Hill, which is a family residency program, and also with Bushir University's residency program. And both Swedish and Bushir are at our Seattle office providing free services to our clients on their physical health. The use of collective medical technology, CMT, has been really amazing. The way that we worked with this is that on a daily basis, we get our notifications. We then communicate immediately with our clinicians, letting them know your client has been at the hospital, either in the emergency department or has been hospitalized. We're able to see why the person's in the hospital. And then we're able to contact the individual to see how we can assist them. Is there anything that we can do? And then also with the goal of also seeing the person upon discharge within 7 days of discharge. We're able to communicate also by uploading our crisis plan into the CMT platform, which has been really, really great. And also we've created care guidelines also as a way to communicate. So that's been wonderful. We really appreciate the CMT platform. It's been great. It's one of my favorite things. Also, our medical assistant reviews the notifications on a daily basis and then is able to connect with the healthcare provider. Many of our clients, because of insurance, lack of insurance, don't have primary care or struggle with primary care. And so our medical assistant has been key to ensure that clients get connected to a healthcare provider and coordinates with that. We've also coordinate with hospitals, with jails, with nursing homes, school districts. And we also have a partnership with the Mexican consulate where individuals that go into the Mexican consulate for various reasons, if they have any issue with mental health or substance use, we're able to assist them and provide just someone to talk to. We're able to see if there's something that we can assist with or we can refer. And that's been a great partnership with the Mexican consulate. During the COVID-19 pandemic, I will say, and I'm very proud to say that we were able to shift our services pretty quickly into remote care. Right away, we created an internal COVID safe private rooms where clients were able to continue to come to our offices, and we provided them with a private office space. They had computers, they had a phone, and they were able to communicate with their clinicians. In that way, all our therapists and counselors were assigned laptops, cell phones, access to HIPAA, compliant Zoom healthcare, and then also Tiger Connect, which is a secure texting messaging. And we've continued to provide services to all our clients, and we've also added new clients. Also, some of the things that we've done is that we've delivered backpacks for the youth that we serve and provided therapeutic materials as a way to engage the youth and kids into therapy. And we've also delivered cell phones to clients who had no method of communication, and also assigned prepaid hotspots to clients in order to provide telehealth services and reliable internet access. Was also our medical assistant tracks all the clients with COVID diagnosis, and she checks in with the client and the family just to make sure that they're doing okay, if there's anything that they need and anything we can provide and assist with. We've delivered groceries to clients during the holidays. We've extended out office hours, which is something that has been pretty great to do now that most of our clinicians are on Zoom. And so several clients had difficulties with your average hours of operation. And so we were able to be more flexible and offer evening hours to our clients. We've also developed a client engagement incentive program where clients who participate in group therapy can receive prizes or a gift card by participating. We've done lots of outreach out in the community in regards to COVID resources and how to respond in Spanish language media and social media platforms, and which also includes domestic violence and co-occurring disorders issues that have happened during the quarantine. Some of the things we've also done is provided a lot of education to our clients, our Spanish-speaking clients, who have had difficulty on how to access telehealth. And so we've provided a lot of training on that to them. Next slide, please. HealthierHere has been just a wonderful collaborator and partner, and just on our efforts to provide equitable access to behavioral health care. Here we've listed some of the grant funding opportunities and projects that we are involved with. We've been able to increase our infrastructure capacity to transition to telehealth. We've provided reliable access to internet-based services via hotspots, provided clients with cell phones, and also increased staff capacities for coordination of care through cloud-based services. And in addition to all the PPE that we've been able to receive for clients and staff use, so that we can continue to provide services in a safe environment. And in addition, at the last bullet that's here is we've also been able to provide emergency fund and rent payment resources for clients and community members. So these are just some of the highlights and some of the things that we've been able to do this past year. And so we want to say that hope and recovery is what we focus on doing in a way that's holistic and whole health. And we want to thank all our partners and HealthierHere for all your assistance. Thank you.
Terry, thank you so very much. Thank you. Thank you for sharing, and thank you for all of the work that Consejo is doing in community. It touches my heart to see you conclude that sharing with the pictures, because whenever I think about Consejo, I always think about the pictures of the engagement that happened with community grants work, and seeing the youth and all the smiles, and just you're truly grounded in community. And I think just such an example of what we're all here to collaborate about. So again, on behalf of HealthierHere, please, we extend our thanks, and we ask you to receive those thanks on behalf of all of the team at Consejo. Thank you for all you're doing. And for our third partner presentation, we have invited Yusuf Bushir from Falis Community Services. Yusuf is a community practice partner. Falis Community Services is a community practice partner. They have also been a Community Grants alumni recipient and an incredible partner in doing outreach and engagement and connection work. So please join me in welcoming Yusuf.
Thank you. I hope everyone is hearing me. Yeah, good afternoon. I'm glad I get another chance to talk about HealthierHere. If I don't say any other word, and the people who talked before me, if I say whatever they say, it's true, I think I'm done. Originally, I came from Kenya. That's where originality is, and I used to live a place called Kakuma. That's a refugee camp in Kenya for 14 years before I get to United States. That's the place where you don't get a water. You have to walk 3 to 4 miles every morning to get water to the home, and food, don't even mention it. I grew up that life, and I came to United States hoping that life will be different and better. And when we get here, it would have been difficult. It was very, very difficult to adapt to the system, from actually getting the groceries, learning how to drive, knowing the traffic, and all those stuff. Imagine health system or any other system working in this country. Few of us might be could navigate or might be even understand how this system works. And most of us, I'm from Somali Bantu, in case you don't know originality, and most of us, we don't talk English. We don't read and write because of the past life we had in our country. There was we were minority there, and we never had the chance to go to school. Most of my community, and it was very difficult to navigate any system, anything in this country. And some of us actually decided to go back. Some of us were very frustrated, and life was really hard. And in 2015, that is when I actually started working, volunteering with the schools and the city. And I just wanted to know more people and to understand how the system works. And it was actually a great pleasure to work with the Kansas City, where I met the former mayor, Suzette Cook, who actually put me into the spotlight to actually, create a non-profit organization to help the community. That was 2015. And before that, I used to help the community with a different capacity, but it wasn't actually official. So that's when I started my organization, which is Falis Community Service. And that name comes from my daughter, who born in Kakuma. So having that hard life, that's why I named it after her. to inspire actually whatever I do. And when we started 2015, it was really, really hard to actually understand how these things work. Though I have been getting on and off help from Kansas City, but it was never been enough. And also the grants you get, it was always, what did you do before? How do you adapt with this system? Can we trust you? Can you give us a track record, what you did? So it was very, very difficult. I think from 2015 to 2018, we only able to get one grant from Seattle Foundation. It's called Neighbor to Neighbor. And that grant, attended by a lady called Tina Abdulaziz, is from Center of Multicare of her, and she was seeing that 200 people gathering, and we have been talking about how we develop our community, what we need to do. She was surprised, and she said, like, I want you to do me a survey. So that's actually how we started working with the Healthier Here. And to tell you this little story, I was about to close my agency that year. It was, I think, in November when she approached me to do that survey. But on December, I and my staff who are working volunteer, we decided to actually close down because we couldn't do it anymore, because we paying all our rents, all our everything, and we couldn't do it anymore. So our decision was to see up to December if we could come up with something. Otherwise, we wanted to close it. And everything changed. When we met them Healthier Here, and everything changed. From that time to this point, I'm actually in a great position to say that I'm serving my community with my head held high because of Healthier Here. Now I'm a part of African Coalition, African Leaders Coalition. I'm a part of Racial Equity Coalition. I'm a part of Kent Nonprofits Coalition, and all that thanks to Healthier Here. They are the one who put me that level of actually people seeing me and recognizing that I can actually work with them and work with the community and help my community. From the beginning, I was never thinking that, this is gonna work out, because everything was difficult for me. The first grant, big grant I get from Healthier Here, my surprising was, it was all about what everyone would have expected who is opening a nonprofit. Like, you make a phone call, you get an answer. You ask a question, you get an answer. And most of the time, you get the instruction to follow. You never get lost. You just keep following and following and following, and everything is falling in a way you want it. My surprising is, one of the things I'm actually always grateful is, one of the speakers before me says that they work with you according to your condition, your situation, your capacity, and everything. I can proudly say that when I started this organization, I had 6 volunteers and myself. Right now, I have 7 employees, and 4 of them is employed under Healthier Here's grant and the work they did it for me. So it has never been a doubt that Healthier Here successful is not something, history they need someone like me to tell. The history is everywhere, and it's just the state, or everyone knows that what they bring into the table is something no any other agency can actually bring. I can say that actually in an honest way, because right now, as I said, I work with the Racial Equity Coalition and other coalitions. None of them could bring what Healthier Here can bring in the table. It is what is that? It's just a trust. They will give you something, but they don't hold the check at the back. They just let you do the work the way you think will be successful for your community. And that's unbeatable. No agency is ever tried to do that. So the other thing is, you are always part of the decision making. Example, we have December 8th, we have a meeting, which we will be talking about the next year's the budget. They have been discussing with you. They will tell you what they get. They will tell you what is at the table. They will tell you what do you think, what needs to be changed. So that means you are part of the decision making, even if you are not on the board, if you are not on the bigger level of the organization, but still you are part of the team. You feel that this is it. This is where you belong, and you will do more work than actually you do the other organizations or other grants. Sometimes you will get people who just estimate you, underestimate you because of your language, because of the capacity you get, because of the work you can do. But HealthierHere is one of the agencies who never, like I was thinking it was only me, I get lucky. But when I looked at the list, there was a few actually organizations who don't even never been existed. First grant they get from HealthierHere. And now they make a name of themselves. Now they do the serving of the community. And I can proudly say that I'm part of it, and I will be part of it until the last breath. And I can tell you what I do, but I think whatever I do, it comes from HealthierHere. Right now, we have been able to serve. I remember in 2018 when I met them, as I said, my serving was 200 people, 300 people a year. Right now, we are able, actually in 2019, we are able to serve 3,722 individuals. It's not coincident. It is something worked by with the HealthierHere. It was great help from them. And anytime I need help, I call one of them. I call Mayani at in the middle of them. You send the email in the morning. Is the email the reply is there. You ask whatever you ask, it is there. I can actually pray for them. There was my friend who was talking before me and saying that this thing is actually something that he never thought is going to happen, and it's a reality. I'm actually agreeing with him, because this thing we never hope is going to be a possibility that we will be growing this quick, and this confident that we have, that we can face everything. I've been doing a lot of other projects, but working with the HealthierHere, it is something I can never forget. As an organization from my community, right now I serve Somali Bantu, Somalis, Asians like Vietnam, I serve Indians, and then I serve also Afghanistan. And all that is thanks to them. It is just like I can expand and expand and expand, and I can help anyone. And I don't actually see, like now my community feels small. I just want to grow and grow and help everyone in Kent or around Kent area. So it is really great working with you guys. I don't know what to say. I'm a board of actually HealthierHere. I'm proud to be board. I'm proud to be member, and I'm proud to be a community practice partner with you guys. I really appreciate every work they do from the beginning to the end. Thank you.
Yusuf, thank you. We are proud and honored to have been invited to be a part of this journey and touching the community members that you're serving and earning the invitation and the respect of Falis Community Services and all of our community partners who are so grounded and rooted in community. My heart is full, and I thank you for sharing. I thank Unkitawa for sharing. I thank Consejo for sharing. And we have so many partners who have similar stories to share. And this is just an example for those of you who know me. I've had an opportunity to be a part of HealthierHere from the Interim Leadership Council, and then the governing board, and then now as part of staff. And my heart is so full when I hear these stories and I hear this sharing, because governing board, this is what happens when you put that hard work into place and those hard conversations so many years ago, before HealthierHere was even HealthierHere. This is what results from that level of intentionality, authenticity, and integrity in doing this work in a way that really honors and centers the voices of the people that we are here to serve and the voices of those who are serving them. So thank you very much, Kyle, Yusuf, Terry, Mario, and Greg for sharing.